Hi, my name is Jane Stapleton and I'm one of the safeguarding leads for First Community, and I just wanted to bring your attention to the fact that it's Adult Safeguarding Week from the 15th to the 21st of November, and this year's theme is all about creating safer cultures. So what is a safe culture? So it's about listening. It's about First Community staff members being able to have the opportunity to listen, to be listened to, and to listen to others, so that we can make sure that we have an environment where concerns are raised and acted on in an appropriate and timely manner. It's about leading, it's about First Community ensuring that they've got the correct access to support and guidance in relation to safeguarding concerns, but also the correct policies and procedures in place to ensure that these concerns are raised in an appropriate manner. And it's about learning, it's about First Community being in an organisation where we reflect and learn where things haven't gone quite right, and that we make actions and make changes as a result of any concerns that we might have been involved in. I'm really proud to say that I believe that First Community do have an environment and do have a safe culture, that we listen to people, that we lead and that we learn. But just don't take my word from it. Here's a few practitioners that have been involved in some safeguarding incidents and how they feel that their patients are safer as a result. Many thanks.
It's Tracey Bennett and I work as a community matron. I visited a patient where I witnessed verbal abuse and aggression by a family member towards the patient. By raising this as a safeguarding issue, I was able to report and liaise with social services and involve the care agency in more detail with her care. The other members of the multidisciplinary team, such as the diabetic specialist nurse and mental health nurse, were also involved. By this involvement, we were able to not only help the patient but also her family. They became less frustrated and angry towards her, and as a result, her health and her mental well-being is improving.
My name is Kerry Standish. I'm one of the occupational therapists working within the Falls Prevention Service. Following one of my visits that I carried out, I was concerned about the patient being at risk of neglect and having his care visits rushed. So I raised the safeguarding, and following this we were able to ensure that a new care agency took over the patient's care and were providing more appropriate care to meet his needs.
Hello, my name is Lynn Fitzgerald. I'm an occupational therapist and I'm one of the clinical leads for bed-based care. We cover Cater and Dean and the community beds in some care homes. Recently, we were asked to participate in Section 42. One of our patients had developed a pressure ulcer under her plaster cast and a safeguarding concern was raised. The Section 42 was passed to us by safeguarding, and then we passed it back to them. It was a really useful process because we actually identified some learning. We identified how we could communicate more clearly with the care home, and also just about our record keeping, if there was any improvements that we could make with those. We shared the learning with the team. We also, as a result, actually have got a booklet now with all the different boots, because when people have their plaster cast removed, they're often given a boot, and they've all got different names and different ways to wear them and different times to wear them, and it just really helped to sort of clarify when to wear them, how to check people's skin when they're being removed, and it was just generally a really useful process.
Hi, it's Jane Stapleton, Adult Safeguarding Lead here again. I'm sure you'll all agree they're really great examples of how here at First Community we create a safe culture in relation to safeguarding adults. But they're not the only people that have raised concerns. Over the last year, numerous nurses and therapists, people working out in the community, have been out and about identifying safeguarding concerns and acting on them appropriately, and as a result our patients have been able to live a safer, protected and more harm-free life. So I just wanted to say thank you on behalf of our adult safeguarding team to everyone that's raised safeguarding concerns. Keep up the hard work, and just remember that our team is here to support you with any advice and guidance if you require. Many thanks.